Good day, my name is Tebogo Tsele-Tebakang. I'm the HOD in the Department of Complementary Medicine at the University of Johannesburg in South Africa. Today I'm going to share my research on the topic herb-drug interaction, where I looked at the perception and revelation of nurses in primary healthcare clinics in South Africa. Just to give the background, this research is part of my doctorate study, where I looked into the disclosure between patient and primary healthcare providers relating to herbal medicine, where I was developing a patient empowerment program for patients to avoid the herb-drug interaction. So this the intervention mapping framework was followed in this study. Looking at the overview of the methodology of my doctorate study, the study was done in phases, where I had phase 1, phase 2, phase 3. In phase 1 is where individual interviews of patient and healthcare providers were conducted, and in the healthcare provider it was nurses and doctors, and then afterwards there was data analysis from these individual interviews, and then went to phase 2, where there was a development of the framework from the gathered data to aid in the development of the patient empowerment program. Then went to phase 3, where there was implementation and evaluation of the program. There was a pre-knowledge questionnaire and there was post-knowledge questionnaire, and there was as well a workshop where patients were educated about herb-drug interaction. And then at the end we had focus group discussion, where there was an integration and triangulation of the results. The significance of the study was to show the importance of effective communication, where there is patient empowerment, where there is an empathetic rapport, where there is shared decision in the consultation rooms between the patient and the doctors, and ultimately the prevention of the possible herb-drug interaction, where patients leave out the consultation room educated and know the dangers of herb-drug interaction. Now coming into the part of the research that I did as part of the study. This is where I looked into the prevention and revelation of nurses in primary healthcare clinics in South Africa. As we all know, that primary health care is a holistic approach that is centered around the needs of individuals, families, and communities. It is the first level of entry to the healthcare system, where health promotion, disease prevention, as well as diagnosis, management, and treatment of ailments are provided. And services are rendered by medical practitioners, by nurses, and other healthcare providers. There is over 3,500 government primary healthcare clinics, where primary healthcare nurses are the first point of contact and vital to the delivery of primary healthcare in these clinics. Post-democracy in 1994, the South African government redesigned the healthcare system from a clinic-based system to a community-centered system, where it provides a strong and effective foundation for the healthcare system that reaches many communities, allowing for early diagnosis, treatment management, and referral to secondary and tertiary healthcare facilities. Herbal medicine has become popular to its global acceptance as a complementary and traditional treatment in South Africa. Herbal medicine can be found as herbs that are made from leaves, flowers, fruits, or seeds. As herbal material can be like fresh juices, gums, or fixed oils. It can be a herbal preparation, or it can be a finished labeled products that contain plants' active ingredients. Research has shown that approximately 60 to 80% of the population of South Africa use herbal medicine for the treatment and management of their ailments. Here are some pictures of the herbal medicines that people of South Africa or people use. So they get this from either the traditional healers or from the herbalist, and we can see there others in the finished products. And in South Africa, these products are used within the traditional ecosystem like in the African traditional medicine, or they can get in their complementary medicine system. For example, the homeopathy, the phytotherapy, Unani Tip, Ayurveda, and aromatherapy. So within the South African context, there is a deeply embedded sense of trust in the use of herbal medicine by rural urban communities. And this could be linked to a culturally diverse population with distinctive traditional health practices and preferences, as we see in South Africa. So the use of herbal medicine is integral to the identity of African people. So this was attributed to the long-standing successful use of herbal medicine for the treatment of many ailments that threatened physical or spiritual existence. Many people rely on herbal medicine due to the perceived effects and low cost of products. Other reasons include the general dissatisfaction with the conventional healthcare system, the high cost of conventional medicine, and their perceived side effects. Moreover, the unpleasant behavior of healthcare providers towards patients also encourages people to use herbal medicine. Additionally, negative behavior from nurses may influence the patient's willingness to disclose the use of herbal medicine. As we've seen in most of researches or studies being done, it has shown that patients do not disclose the use of herbal medicine to their healthcare providers willingly because of these negative behaviors. And the core principle of effective communications aligns with the role of nurses and that of the healthcare providers. Therefore, effective communication and interpersonal skills should include cultural sensitivity and acknowledging patient use of herbal medicine. Active ingredients in herbal products can alter the pharmacokinetics and pharmacodynamic properties of prescribed medicine, resulting in various severe clinical adverse effects. As we know that herbal preparations contain several active ingredients, all of which are associated with unknown adverse effects ranging from mild, like your allergic reaction, gastrointestinal upset, and nausea, to moderate, like your coagulation abnormalities, to severe cerebral hemorrhages, and ultimately death. Additionally, herbal products may have antagonistic effects which could cause potential therapeutic failure, as seen with many drugs like your diuretics and antihyperlipidemics. For example, your ginkgo biloba can induce seizures when combined with phenytoin or valproic acid, and excessive bleeding when combined with warfarin. Another herb, Korean ginseng, or popularly known as Panax ginseng, can cause sleeplessness, tremors, and headaches when used concurrently with phenelzine. And there were several studies that have been conducted in South Africa examining the concurrent use of herbal products in conventional medicine, where the result showed or identified adverse effects including altered gastrointestinal functioning of the drug absorption, induction and inhibition of metabolic enzymes, and alteration of renal excretion of drugs and their metabolites. Poor reporting from patients using herbal products and the inability of healthcare providers to identify the herb-drug interaction play a major role in the limited reporting of herb-drug interaction. The South African Medical Research Council's Biomedical Research and Innovation Platform noted in 2018 that 60% of adverse drug reactions reported resulted from the concurrent use of herbal medicine. This warrants an investigation into the nurse-patient communication around potential herb-drug interaction during the consultation. The purpose of the study was to explore and describe the perception and revelation of primary healthcare nurses regarding the use of herbal medicine, as well as to see whether nurses communicate to their patient about herbal medicine use and addresses the anticipated herb-drug interaction. This study was exploratory and qualitative in nature, conducted in 3 provinces in South Africa, namely Gauteng, Free State, and Mpumalanga. And these areas were chosen because there is a lot of increasing use of herbal medicine due to urbanization, as well as there's a lot of commercialization of the herbal medicine products. And 8 primary healthcare nurses were recruited for a face-to-face digitally recorded interviews, and then later data was transcribed and coded using a content analysis. The population of the study consists of primary healthcare nurses who met the inclusion criteria, being a registered nurse in primary healthcare clinics and employed in those particular primary healthcare clinics. And 8 primary healthcare nurses were recruited in the 3 provinces mentioned. And the primary healthcare clinic selected were in Black Township, or in urban areas. And the primary healthcare clinics and provinces were selected using the random sampling techniques, where the list from the National Health Research Database was used as a sample framework. Once permission was granted by the Provincial Health Research Committee of each province, the recruitment process commenced. Data was collected during 2018 and 19 using individual semi-structured interviews until data saturation was reached with 8 nurses. And the researcher approached the participants in person in primary healthcare clinics, where the purpose of the study was explained and a request to participate was made. Participants were made aware of their right to withdraw from the study at any point during the interview without consequences. And participants who agreed to participate in the study were requested to sign the consent form to participate in the study and for audio recorded prior to data collection. And the voice recorded interviews were conducted in English in a private consultation room, allowing participants to feel free to express. Code switching was accepted during the interviews to clarify some of the English words, and each interview lasted between 30 to 45 minutes. And each interview began with the following question: what do you understand about herbal medicine? Then later followed by further questions or probing questions. For example, what is your perception of herbal medicine? Do you ask your patient about herbal product use? If no, or if why not? And if yes, does the response encourage open communication about herbal medicine? Are you aware of herb-drug interaction? Do you make your patient aware of herb-drug interaction? Or how do you think you can encourage open communication about herbal medicine use, or as well as if there were any other comments from the participants? And then data analysis was used, and this involved the initial narrative analysis at the semantic level to bring meaning to what the participants said. Then coding of data was divided into primary and secondary cycles. Primary cycle involved the summary of data segments, whilst the secondary cycle grouped these segments into categories and themes. And then the categories and themes were combined, analyzed, and the findings were deduced. And 5 themes and 3 sub-themes emerged from the data to address the aims of the research. And then the qualitative data analysis software was used for further analysis. And then these are the main categories and the subcategories extracted from the data. And the main categories were nurses' perception and personal use of herbal medicine, nurses' knowledge of herbal medicine and herb-drug interaction. And then in this theme, then we had subcategories of pursuing knowledge of herbal medicine by nurses, nurses' advice, and nurses' discouragement of herbal medicine use. Then we had another theme, the third theme, that is inquiring about the use of herbal medicine, the nurse's behavior, and the patient's disclosure of herbal medicine use. Participants of the study were all females aged between 30 to 63 years and had more than 5 years of clinical experience. And these demographics concur or was confirmed by the South African Nursing Council. And participants were given a numeric identification for reporting purposes to ensure. Going into the results, theme 1, nurses' perception and personal use of herbal medicine. In this theme, participants showed positive attitude towards herbal medicine. They reported using herbal products and mentioned that during their upbringing, they use herbal medicine to treat ailments. As we see there with participant 1 says, we grew up using and making our own medication, so it is normal, it is just acceptable. And participant 6 says, they are good if they are used with cautious by someone who knows. They are effective because they don't have preservative. However, there's one participant who did not trust the use of herbal medicine and says, I don't believe in them unless I go to a professional doctor. Some doctors use herbal medicine. They combine them because they have studied herbal medicine, but those from traditional doctors, I do not use them. Theme 2, nurses' knowledge of herbal medicine and herb-drug interaction. So in this theme, participants were asked if they knew what herb-drug interaction was. And the result shows that nurses were familiar with the term herb-drug interaction, but they lacked the understanding of the pharmacodynamic and pharmacokinetic mechanisms of herb-drug interaction. As we see here with participant 2 says, yes, I know about herb-drug interaction, even though I don't know what is interacting with what, but I know there is interaction. Another one says, yes, I'm aware that there is interaction between herbs and our medicine. And the last one says, yes, because whatever they are taking might interact with the herbal medication, so you must check what they have. Most of the time, we don't know much about herbal medicine, what they contain. Sub-theme 1 under theme 2, that is pursuing knowledge of herbal medicine by nurses. Here, participants recognize their limited knowledge of herb-drug interaction and raise the importance of gaining knowledge about herbal medicine. Participant 8 says, I think if we can get some education on how herbal medicine work, it can help the nurses. And participant 6 says, because I absolutely know nothing about African potato, if we can know the benefits and what it contains as a nurse, I can educate the patient. Sub-theme 2, nurses' advice. Despite participants declaring their lack of knowledge of herbal medicine, participants still gave varied advice on herbal medicine to their patients. One participant mentioned that she usually recommends natural remedies to her patients instead of conventional medicine. What she says is, I normally advise them about natural remedies. I will advise them on how to use things naturally instead of using medication. And on the other hand, other participants mentioned that they advise their patient not to take herbal medicine and conventional treatment concurrently, rather than discouraging them to use herbal medicine at all. So the other one says, I give them information just as I advise them, not like telling them to stop. The only thing I can do is to advise the patient that if you are using this from us, you are not allowed to add with this, like especially the pregnant patient. And then the other one said, our people believe too much in herbal medicine, so it is very much important to tell them, let's do things this way. And it is not necessarily saying do not believe in your things, but we do things the other way. Sub-theme 3, the nurse's discouragement of herbal medicine use. Participants' lack of knowledge on herbal medicine has proved to be the dominant finding as a hindrance to the herbal medicine communication between primary healthcare nurses and patients. Some of the participants felt that they would rather discourage the use of herbal medicine instead of advocating for it due to the lack of knowledge. One participant says most of the nurses discourage patients from taking herbal medication because they don't know how this herbal medication works, so they will play safe by discouraging patients to take it. Another patient said, we nurses, we know nothing or very little about these herbs, so to us they are wrong, so it must be stopped. Once they say, I'm drinking something, we say stop. It will interact with whatever I'm giving. We don't say it might interact. Theme 3, inquiring about the use of herbal medicine. Some of the participants in the study declare that they do inquire about the use of herbal medicine by their patient. One participant said, "Yes, we do. Part of the initial interview with patient is to ask what medicine you are using." The other one says, "Always, I ask them whether they are on herbal medicine." However, some participants confirmed that they have never inquired about herbal medicine use with their patients. This other one says, "Not really. The only time I found myself talking about herbal medicine will be when a person says to me, 'Sister, I'm coming here to ask you to give me contraceptives. I just want to know if this herbal tea that I'm on is going to make my contraceptive pill less effective.'" And the other participant said, "We hardly ask, 'Do you take any herbal medicine?' We only ask when you realize something is not working, like the current medication you are giving is not working." Theme 4, nurses' behavior. In this theme, we've seen that all participants express that the manner of approach, how questions are asked, and a positive attitude towards patients are essential in healthcare. They mentioned that these behaviors have a direct impact on patient non-disclosure of herbal medicine use. One participant says, "Manner of approach is very important. They are open and say, 'I'm using this or something at church or at home we are using this.' They are honest depending on how you ask that question and your approach." Another one said, "First thing, you as a sister, you don't have to be judgmental, because as soon as you get judgmental, the patient will not open to you." The last one says, "The attitude is very much important. It does not only go about attitude but also respect. The client, once you respect him or her, you gain her. But if ever you come with a negative attitude, it is not going to work." Theme 5, that is patient disclosure on herbal medicine use. So with a lack of communication between patient and nurses being the barrier to patient disclosure of herbal medicine use, participants in the study confirmed that patients are not forthcoming about the use of herbal medicine, or when asked about it, they are not honest about their answers. Participant 3 said, "Normally they say they do not use any herbal medicine. Even if you can see the signs and symptoms that they might have taken something, they will say, 'No, no, no, I don't do that. My grandmother does it, but I don't.'" Another participant said, "Some do say they started using herbs first before they come to the clinic, as some will believe they have been bewitched and they started at the traditional healers first." And then coming to the discussion of the study after analyzing the data or the views that we've seen or we've heard from the patients. So the purpose of the study was to explore and describe the perception and revelation of primary healthcare nurses regarding herb-drug interaction. So most participants in the study, as we've seen or we've heard, they had a positive attitude towards herbal medicine and confirmed that they used herbal medicine during their upbringing to treat diseases. And these findings are supported by a review conducted on 21 studies where the overall use of complementary medicine by nurses and the main modality used was herbal medicine. On the other hand, we've seen that there were some participant or a participant who showed a lack of confidence in herbal medicine because they are not prescribed by a medical practitioner. So this view could be attributed to the insufficient scientific evidence of herbal medicine in the public domain and the fact that most herbal products are waiting to be regulated and registered by the South African Health Products Regulatory Authorities, or SAPRA in short. Evidence have shown that the majority of South Africans use herbal medicine, yet the nurses of South Africa lack of knowledge is concerning. All participants in the study, we've heard that they declared that they lacked adequate knowledge on herbal medicine and their understanding of herb-drug interaction was insufficient to respond to their patient inquiries. Having a clear understanding of herbal medicine and the mechanisms of herb-drug interaction offers the nurses a basis to educate and assist patients in making informed decisions about using herbal medicine. So a study by Cheng and Cheng 2015 found that primary healthcare nurses' lack of knowledge regarding herbal medicine products prevents them from warning patients about the consequences of herb-drug interaction. Therefore, to avoid possible herb-drug interaction, nurses must understand herbal medicine and be adept in effectively communicating the associated risk and benefits with patients. Even though nurses in the study admitted that they lacked sufficient knowledge regarding the use of herbal medicine, a recommendation was that obtaining more information about herbal medicine will enable them to give reliable information to their patients. There are several studies that correlate with these findings where primary healthcare nurses express the need to have training on complementary medicine and for it to be included in the nursing curriculum offered at various learning institutions. Despite the recommendation to include herbal medicine in the nursing curriculum, in South Africa, like any other countries in sub-Saharan Africa, currently there is no consideration to include herbal medicine in the nursing curriculum, even though the nurses are pleading to have herbal medicine added into their curriculum. In the current study, participants shared mixed feelings on advising patients about herbal medicine. If we've said or heard with what the participants said, participants who confirmed that they use herbal medicine were the ones who recommended the use of natural remedies to their patients. Consistent with this finding, a study by Ott et al. Revealed that nurses who have a positive experience with herbal medicine are likely to recommend it to their patient. Other participants mentioned that they will advise patients not to concurrently use herbal medicine and prescribed medication rather than discouraging their use of it completely. So this might be due to the participants' uncertainty about the safety of herbal medicine and their responsible way of minimizing. The findings by Noor Abdulhadi et al. 2012, Sub et al. 2018 confirm that it is better to communicate with patients about the dangers of concurrent use of herbal medicine and prescribed medication rather than a direct instruction to stop using herbal medicine. And this is what we've seen with the participants saying they'll rather tell the patient not to use herbal medicine concurrently with prescribed medicine instead of telling them to stop them completely. So according to Trail Mahan et al. 2013, nurses will rather discourage the use of herbal medicine than advocate for it. So this behavior might be seen as a natural response of nurses trying to be cautious and avoid giving unreliable information to patients due to their uncertainty about the efficacy and toxicity of herbal medicine. Additionally, Bahal and Legal 2017 concluded that healthcare providers first need evidence-based guidelines of herbal medicine to be able to recommend it. Considering the minimal evidence to support the safety of herbal medicine, primary healthcare nurses need to receive training to be able to communicate better with patients about the use of herbal medicine. Results of this study show that nurses do ask patients about the use of herbal medicine. However, this does not constitute an effective communication regarding herbal medicine and possible herb-drug interaction. Effective communication, according to Trent Hall, is a process of acting of information. The lack of effective communication could be influenced by primary healthcare nurses' limited knowledge of herbal medicine. So this finding differ from numerous findings where they mention that nurses who have basic knowledge of herbal medicine are more likely to inquire about herbal medicine from their patients. According to primary healthcare nurses in the study, they do inquire about herbal medicine use despite declaring the lack of knowledge on herbal medicine. This might well have been motivated by the fact that South Africa is a culturally diverse country with historical uses of traditional herbal medicine by its population. The results also revealed the inconsistency in the collection of patients' medical history by primary healthcare nurses, where some of the nurses inquire about herbal medicine use and others don't. The reason could be that within the South African clinical context, the standardized form for record keeping does not specifically reference the use of herbal medicine. Hence, nurses, others they will ask and others will not ask. Moreover, the inconsistency within the provinces is reflected in the differing views of the nurses regarding the use of herbal medicine. These results require a call to action or of action for policymakers and healthcare stakeholders in different provinces to review the medical history taking form and include herbal medicine as a separate component in these record-keeping forms. Additionally, the provinces should mandate that every nurse inquire about the use of herbal medicine to prevent unnecessary strain on the healthcare system of patients revisiting these facilities with herb-drug interaction. And the poor communication and negative behavior shown by nurses towards patients is constantly heard in the media and has been substantiated in previous studies. Participants in this study spoke about and acknowledged that nurses need to approach their patient appropriately and should not have a negative attitude towards their patients. This is confirmed by Haskins and colleagues 2014, where nurses in a South African hospital mentioned that negative attitude that they observe from their colleagues is that the respectful communication with patient. In the same study, participants emphasized that a respected, non-judgmental medical history should be collected from patients using herbal medicine. Although individual nurses' attitude varies, participants in the study had a common voice about their colleagues' behavior towards patients. Lastly, participants confirmed that patients do not voluntarily disclose the use of. These findings indicate a common behavior pattern of non-disclosure by patients regarding the use of herbal medicine to their healthcare providers. So several studies have been conducted in South Africa and globally confirming these findings that patients do not voluntarily disclose the use of herbal medicine to their healthcare providers. And the non-disclosure of herbal medicine use may lead to the underreporting of herbal medicine, which will result in the lack of factual data regarding herb-drug interaction cases. Even so, primary healthcare nurses, they need to encourage patients' participation to ensure patient care is not compromised. The study came with limitation, and as it was conducted in only 3 provinces, and in South Africa we have 9 provinces, therefore the findings cannot be generalized, as well as more studies are required to replicate these findings. In conclusion, the results of this study show that primary healthcare nurses do ask patients about the use of herbal medicine. However, the patient-nurse dialogue is limited due to insufficient knowledge regarding herbal medicine by nurses. As a result, the nurse tend to discourage the use of herbal medicine. Also, the primary healthcare nurses was found to influence the ability of patients to discuss the use of herbal medicine. And understanding, attitude, and open communication are the key elements to identify and prevent misinformation and potential herb-drug interaction. Accordingly, it is recommended that an educational component of herbal medicine be included in nurses' curriculum to raise awareness, broaden knowledge, and emphasize the need to inquire about herbal medicine use. This will subsequently ensure nurses are empowered with the knowledge required for herbal medicine and enhance the reporting of herb-drug interaction cases. Consequently, a recommendation will be to implement a monitoring system of communication regularly through patient satisfaction surveys. Another recommendation will be for the 9 provinces in South Africa to make it mandatory that the method of gathering medical history should include herbal medicine use. Thank you for your attention. Hope you enjoyed the presentation. Thank you.